Hello everyone, today let us understand what is generalized anxiety disorder. It can be described as excessive, persistent, unreasonable anxiety or worry regarding day-to-day activities like going for work, anything related to family issues, relationship issues, or about money or any trivial matter in the day-to-day life can bother a person and lead to anxiety. This is called as generalized anxiety disorder. So when we tell it as excessive, it means that what usually a normal person would worry about in that particular situation, it is more than that. That is why it is called as excessive. Persistent, it means that it is persisting constantly for a long duration of time. And it is unreasonable. What a normal usually that particular situation may not require a person to get anxious about, but still that person may feel anxious about, then it is called as unreasonable. So when this kind of an anxiety is persistently present for most of the time during the past 6 months, then we call it as GAD or generalized anxiety disorder. It can be a mild symptoms or a severe symptoms. When it is mild enough, they may be able to carry out with their day-to-day activities. When it is severe enough, it can be very debilitating and they may not be able to carry out with their day-to-day activities. And usually they even realize that their symptoms are very unusual, or it is not required for them to be so anxious in that particular situation, but still they will not be able to control their symptoms during that particular situations, and they feel anxious about. And it can also be associated with other symptoms like feeling always on the edge, restless, and they may not be able to focus well or concentrate well. They may go blank. They feel always tired. And there can also be other physical symptoms like muscle aches, muscle pains, and chronic digestive issues, which can and also one of the most common symptoms which we can see is chronic insomnia, or they may not be able to sleep well because of the anxiety issues. This can affect their physical well-being, also lead to something called as chronic fatigue syndrome. So this kind of symptoms are seen in generalized anxiety disorder. It is most commonly seen in females when compared to men. There can be also a family history whenever the person comes to us with these kind of symptoms. It can be treated with psychotherapy as well as medications. Psychotherapy mainly includes cognitive behavior therapy, in which mainly the way they think can be modified with certain therapy techniques, which helps them to react in a different way in the particular situations and reduce their anxiety. Treatment involves psychotherapy as well as medications. In psychotherapy, it is mainly the cognitive behavior therapy, in which how they think in a particular situation can be modified so that they react to that particular situation in a better way and their anxiety is under control.